Okay, so first of all, let me thank you really for this invitation to update you on the Givinostat development. I'm Paolo Bettica. I'm the Chief Medical Officer of the Italfarmaco Group. And Italfarmaco is actually the manufacturer of Givinostat. And let me tell you that Givinostat was recently approved in the US for the treatment of Duchenne muscular dystrophy in patients 6 years and older. But let me also remind you that Givinostat is actually not approved in any other geography outside the US. So it's still currently under development in all the other geographies. And that this presentation is really intended for dissemination and discussion of scientific information only. So before actually talking about Givinostat, let me spend 1 minute in describing Italfarmaco for those of you who are not familiar with the company. So this is a privately owned company. It was founded in Milan, Italy, more than 80 years ago. We actually operate now in over 60 countries on 5 different continents. Is a company of more than 3,000 employees all over the world. And during the last 12 years, we have actually worked quite intensely to develop a treatment for Duchenne muscular dystrophy. And we are actually committed to ensuring that patient needs and voices actually lead the way in our quest to provide support and solution. So let me then move to Givinostat. So what is Givinostat? Givinostat is a histone deacetylase inhibitor that actually modulates the HDAC pathway, which is actually not functioning properly in Duchenne. And this is actually part of the development of the disease. As I said, we are developing Givinostat for Duchenne, but also for Becker muscular dystrophy, where we actually conducted a phase 2 study, and also for another rare disease, which is called polycythemia vera, where we have recently entered phase 3. As I mentioned before, Givinostat is approved in the US with the name of Duvyzat and was launched recently. And it is currently under review by the European agency. So let me try and describe the mechanism of action of Givinostat. To do so, let me firstly remind you the role of dystrophin in the muscle. So you are probably very familiar with the mechanical protection role of dystrophin, where the presence of dystrophin allows mechanical stability to the muscle fibers. But probably less known is actually also the role in controlling the repair of the muscle once it is damaged. And actually, this is a very important role of dystrophin. And at least in part, this is done via the control of HDAC activity. So when dystrophin is absent, as is the case for Duchenne muscular dystrophy, not only we have a mechanical instability, so we have more damage to the muscle fibers, but also the repairing system does not work properly. And at least, as I said, this is in part due to the fact that the dystrophin complex is not controlling the HDAC activity anymore. And therefore, HDAC are overworking. And this actually translates into less muscle regeneration, for example, and also less potential anti-inflammatory effect. So when dystrophin is absent, as the cartoon describes, what you see in the muscle is a chronic inflammation. You see an impairment in muscle regeneration. And at the end of the day, the muscle fibers which are being damaged are not replaced by new muscle, but are actually replaced by scar or fat. So when we add Givinostat to the equation, so when we administer Givinostat, what we see is actually a control of the deregulated HDAC activity. And overall, we see a reduction in the inflammatory, in all the inflammatory processes. We see an increase in muscle regeneration. And all in all, we see less scar and fat replacement. This slide is actually summarizing the development of givinostat past and present. So we actually started with study 43, which was a proof of concept study in 20 Duchenne boys who were on stable corticosteroid. And after 1 year of treatment, we actually looked at their muscle biopsies. And what we saw was exactly what I described before. So a reduction in inflammation, a reduction in fibrosis and fatty replacement, and increase in muscle. This actually, the result of this study triggered the EPID study, which was our pivotal study, and I'm going to spend a bit more time in the next few slides. And the boys that actually complete the study 43 and complete the EPID study were allowed and invited to enter the open label extension study, which is actually still ongoing and will continue until givinostat is approved in the different countries, including Canada. And then we recently also started another study, which is called the Ulysses study, which is also running in Canada. And this is actually a study that will look at efficacy and safety in Duchenne muscular dystrophy boys and young adults age 9 to less than 18 who have lost already the ability to ambulate. And they will be randomized to either givinostat or placebo in a ratio 2:1. So you have they will have more chances of actually receiving givinostat, and they will be followed up for 18 months. The primary endpoint is the performance of upper limb. And then we will also be measuring the respiratory function and also the fat fraction of the deltoid and the biceps, so of the upper limb. And let me remind you that givinostat is actually a liquid suspension that is taken with food twice a day. So these are the sites where the open label extension study, but most importantly, the Ulysses studies are running in Canada. And at the end of my presentation, I will show the email address of our patient advocacy where you can ask questions, but you can also find the details going to clinicaltrials.gov. Okay, then let's talk about the EPID study, our pivotal study that was the key study for the registration in the US and it's under review in Europe. So this was a study that looked at effectiveness and safety of givinostat in the treatment of Duchenne. And it was a randomized double-blind placebo-controlled study. And the participants were actually followed up for 18 months. In total, we enrolled 179 boys with confirmed diagnosis of Duchenne. And they were actually randomized 2:1 to receive either givinostat or placebo in a blinded fashion. We actually included male patients, obviously, that were 6 years and above, and they were all ambulant at study start. And all patients were actually on stable steroids for at least 6 months before entering the study. In this cartoon, I'm actually summarizing the result of the primary endpoint. The study was a positive study, so it met the primary endpoint, which was the difference in change after 18 months in the time to actually climb 4 stairs. And as you can see in this cartoon, the gray line is actually placebo, where, as you can see, at the end of the 18 months, the boys gain more than 2 seconds to climb the 4 stairs. And actually, this was significantly less in the red line, which is givinostat. The primary endpoint was actually the difference at the end of the 18 months, and the difference was actually of 1.78 seconds. And as I said, it was statistically significant. The study included a number of secondary endpoints that looked at function, such as the North Star, the time to rise from the floor, and the 6-minute walk test. We also measured strength of both the knee and the elbow. And actually, this was the only phase 3 study that also looked at fat fraction as a secondary endpoint. And as you can see in this forest plot, all the results are actually in favor of the givinostat group. Let me then spend pay a bit more attention to some of them. Some, like for example, the North Star. As you know, the North Star is actually a very important endpoint in Duchenne, and it's actually very important to show that the also in this case there was a difference at the end of the 18 months between the total North Star in the control group that you see here, this light blue, which was in the control group, they lost a bit more than 4 points compared to a loss of 2 points in the givinostat group with a p-value of less than 0.05. As I said, this was the only pivotal study that looked also at fat fraction. And also here we had a difference between the givinostat arm, where you see there was an increase of approximately 7% in fat fraction, which was actually different from the increase of 11% in the placebo arm. When we looked at safety, in essence, what we saw was a profile that was very much in line with what we knew of givinostat. So with the most common adverse event being GI side effects, such as diarrhea and vomiting. We had a reduction in platelets, which is actually a pharmacological effect of the HDAC inhibitor. And we also had an increase in triglyceride. All the other parameters were actually similar to the control arm. And let me also say that all the adverse events were either mild or moderate, with only few severe adverse events, and could actually, we could control them by dose adjustment and, if needed, dose interruption. As I said, the boys that were enrolled in the phase 2 study and in the phase 3 study then continued being treated in the open label extension study. So we are able to look at the effect of givinostat on milestone of disease, such as, for example, the ability to walk, so the ambulation or the ability to climb stairs. And here you see a comparison between givinostat, which is the green line to the natural history. And as you can see, there was actually a delay in the age at the loss of ability to walk and loss of ability to climb the stairs of approximately 3 years compared to the natural history. So let me conclude by saying that obviously givinostat blocks enzymes which are called HDAC, which are actually important in the evolution of Duchenne. As I said, givinostat is administered twice daily as an oral suspension. It was approved in the US recently, and it is under review in Europe. And as I mentioned, there is a clinical trial recruitment which is ongoing in the Ulysses studies, which is a study in non-ambulant boys aged 9 to less than 18 years. And with that, let me thank the children, the families, the advocates, and all the physicians that actually have been working with us in the development of givinostat. And thank you for your time and attention.